non-surgical procedures. Are they worth it? This coming from a plastic surgeon with 25 years of experience. I practice in Honolulu mainly, but I also practice in the Middle East, in Dubai and Qatar. I have one of the busiest practices in the United States, so I feel qualified to talk to you about plastic surgery and related topics. These days, the most common non-surgical procedures that we see in the aesthetic medicine setting are Botox and some type of filler. Botox everybody knows about. Botox has many different variations under different names made by different companies, but these are all essentially what we call neuromodulators or neurotoxins. What Botox and related substances do is they paralyze muscles. This is done through an injection of a concentrated liquid, very tiny amounts, into usually the face, although we can inject neurotoxin in other parts of the body for different reasons. And this paralysis of muscles stops the face from moving and creating a wrinkle. This is very different from fillers because fillers fill an area of the body with a substance that is usually temporary. And this is done through an injection. Fillers first were used to fill in wrinkles. So if you had a wrinkle in the face, we would inject that wrinkle with filler and that would smooth out that little valley, and then the wrinkle would be better. Since then, fillers have moved on to many different purposes. We can shape the face, for example, change the shape of the jaw or the chin. We could fill in the cheekbone, fill in hollows like in the temple. So there are many different uses of filler as well as many different uses of Botox. When these two things are used together, they could dramatically shape a person's face, make them look younger, make lips fuller. There really are many different applications of these two substances that are done through an injection, which is a much easier and simpler thing to do than surgery. So are filler and Botox worth it? They're absolutely worth it. When we look at the growth of fillers and Botox compared to plastic surgery, for example, filler and Botox is growing exponentially compared to what I do. And this is because it's accessible. You can go to somebody's office, you get an injection, the downtime is minimal. It's really just an injection of something. You may have some bruising and swelling afterwards, but that's pretty much it. When I look at what we're able to do with injections nowadays compared to 25 years ago, things have just completely changed. Whereas before, changing the shape of somebody's face may have required implants or carving out bone or even breaking bone in the face, we can really make a significant difference for somebody with just an injection. Before, we didn't really have a great way to treat wrinkles in the face. And honestly, surgery probably isn't the best way to soften the lines in the face like Botox does. So absolutely, if you are considering fillers and Botox, it's something that works extremely well for certain things. And if you find somebody who is an expert at this and has experience and has a great eye for, and if you find somebody who's experienced and good at injections, you will have an amazing result. However, there is a limit to what injections can achieve. And the problems that I see with fillers and Botox is that once a patient gets to a certain point in terms of their aging, fillers and Botox are really not going to do very much. For example, I see many patients who are what we call overfilled, and that is because whoever's treating the patient with injections wants to do something to make them look and feel better. And that's a natural thing to do. However, there's only so much you can fill the face. And in my opinion, fillers and Botox will never do any sort of real lifting of the face, which is what is needed when we age. For example, I've talked about cheek filler before. And as we age, the face descends. It vertically descends and becomes droopy and saggy. And you can see lines like the nasolabial fold, or what we call the marionette line, becoming deeper and deeper because this part of the face is drooping. You can only fill the face so much in that kind of setting. And usually what we do is we put some filler in the cheek, we can put some filler in this line here, we can try to support this area with a little bit of filler application as well. But you have to understand that when we're doing this, we're camouflaging the sagging of the face. We're not actually lifting the face. We're not repositioning things. And that's basically what needs to be done with surgery if somebody has significant aging and they want to address the drooping of the face. What we do in surgery is we actually take apart the face, the skin layer, the deeper layer, we pull things up, bringing the anatomy into a more we are restructuring the anatomy into a more youthful configuration. And in my opinion, that can never really be done through an injection or even a machine that is supposed to lift the face. The other problem I can see is over-injecting certain areas. For example, non-surgical rhinoplasty is usually just the filling of the bridge of the nose. Sometimes you can fill the tip a little bit, but my feeling is that you really can't change the tip that much with an injection. But sometimes the nose can be overfilled and it just doesn't look natural. This is in contrast to when we do a rhinoplasty, where we can raise the bridge with either cartilage or an implant, and that generally looks a lot more natural and can be balanced with the tip of the nose when we rework the tip of the nose, for example, in a rhinoplasty. And chins and jaw can become overfilled and look very unnatural. I find that a chin implant or jaw implants can look a lot better, are permanent and long-lasting, unlike a lot of filler application in the jawline and the chin. Lips definitely can be overfilled with filler, and when there's too much filler in the lips, they can feel firm and hard and unnatural. But again, it's usually the degree. We have expert injectors in my practice. They do a beautiful job at injecting lips and jaws and other parts of the face. And if it's done naturally, I think it looks amazing. So there you have it. Talked about injections, fillers, and Botox and how they work very well, but sometimes surgery might be a better option. Fillers and Botox have to be done perfectly to have the most natural and best results. If you enjoyed this content, please give us a like down below, give us a comment, and subscribe to this channel, and we'll see you next time.